Perfect. If you're ready, I'll give a brief introduction.
Yes, I'm ready.
Wonderful. Welcome, everyone. My name is Mary Ann Dawson. I'm Associate Director here at the FedEx Institute of Technology at the University of Memphis. We're pleased to welcome today Professor Magdala Novas. She is a full professor of medical informatics and coordinator of the telehealth center at the Federal University of Pernambuco. I hope I didn't mispronounce that too terribly. She is a former vice president of a Brazilian Society of Health Informatics, a member of the Digital Health Group at the National Education and Research Network and Brazilian Association of Telemedicine and Telehealth, an IMIA group of telehealth and fellow of the IASHI, which is the International Academy of Health Science Informatics. She's been working in the medical informatics for 30 years, and she started her career in bioinformatics. With more than 300 publications in journals and conferences, her publications directly addressed health informatics and telemedicine applied in several specialties, focused on public health and primary care, as the principal investigator or co-investigator in all of these studies. And with that, I'll turn it over to Professor Novas. We welcome.
Thank you so much for inviting me. I apologize for my English because my natural language is Portuguese. So if you can understand something, please let me know. Okay. And I'd like to. I'm losing my voice also. I don't know what's happened. It's a kind of return of audio.
Your audio?
Yes.
I'm unsure, but we can hear you perfectly.
Yeah. Okay. Okay.
Yes.
Okay. It's just because I'm really. Okay. Let's continue. So I'd like to thank you, Dr. Ashish George, for inviting me to talk with you today. I'm going to present to you a case report about our strategy to face COVID in Brazil. And especially concern my telehealth center, NUTIS. It's a center at the Federal University of Pernambuco. And before starting, I'd like to present some Brazil facts. And we are a very huge country, so more than 200 million inhabitants and several states and almost 6,000 cities in the country. Our state, Pernambuco, it's just on the corner on the northeast region, and it's about 10 million inhabitants, and we have several sectors here, but IT, information technology and healthcare, is our major sector of market here. And right now I'm in Recife, the capital, in the coastline, so some pictures for you just to take a look and invite you to visit us sometime, maybe. And I'm very happy to talk with you from this very beautiful part of the country of Brazil. And some facts about Brazil. Brazil has the fourth largest connected population in the world. We have more than 100 now, I think more than 150 million people connected, and part of the population has access to cell phone, almost 100% of the population. And now we are access to the 5G internet connection, and we have a lot of equipment and technology for healthcare monitoring, like wearables and digital equipment for diagnosis and treatment. And also we had some hospital in Brazil that has robotic surgery. So we have a lot of technology in the country, but we have a kind of divide because we have some very poor regions in Brazil. So sometimes the there are cities that has no kind of technology at all, but the majority at the coast area and maybe in the center also has a very good connection, very good internet connection, and has access to some healthcare service. And as this, actually, the strategy of our government is to deliver a digital service to all population with a high quality, and they delivered an app. It's an application that we call gov.br, and this gov.br, it's an application that all Brazilian has access to their basic information. And we have now more than 170 million inhabitants connected to the gov.br, and more than 4,000 digital services. We are considered now the one of the most digital nations in the world, and we had really improve our connections and our digital services, transforming all the operational model of information. And this application serves also for managing public policies in Brazil, and to serve the population, the citizens, in view of the opportunity arising from technology and social developments. So it's a very, very huge achievement that we have for the last 2 or 3 years in Brazil, and I think it's very important to highlight that for you. Concerning healthcare factors, what we have here, Brazil has one of the, maybe it's the biggest, the largest public health system in the world, but we have 100% coverage of healthcare services here, but only 75% of the population has actually access to the public services, and only 25% of that has a private private plan. It's like a kind of private services to private hospital and private clinics, but all of the population has access to the public health system. And what we find here that is, we have almost 10,000 hospitals, for example, and we have about around 80% of Brazilian establishment of health with electronic health system, but only 21% keep clinical and registration information in patient records in electronic format. So we have the technology in our healthcare facilities, but the majority has some difficulties to keep all the technology available for their professional healthcare professional and patients. And considering the digital governmental strategy, the digital health strategy has launched in Brazil in 2019, and just after that, the federal government has published an ordinance with a plan to develop the digital health in Brazil for the next 8 years, from 2020 to 2028. So the idea with this digital health strategy is the expansion of access to health information, aiming to the continuity of care and at all levels of services in Brazil. And the idea is to qualify care and also the flow of the information, strengthening the support of clinical decision, health care surveillance, regulation, and management, teaching, and research. So this is our document, our baseline to develop digital health in Brazil. And it's very important because we were working and with digital health since early the years of maybe 2000. But in fact, just from 2018 or 2000 or 2018 or 2019, we really started to develop this kind of strategy in Brazil. And this document is available. I give to you here the address if you can take a look on that. But I'd like to highlight just some of the main priorities of this strategy plan. And we have as the first one, the governance and the leadership for the strategy. And second, the digitalization of the 3 levels of care. Brazil has a system that we have primary care, specialized care, and high specialized care. So we have 3 different levels of care, and the idea is to have all of them with digital health strategy. We have also to support, to give support for improving healthcare. I highlight here the user as a protagonist. I think it's the major issue that we have in Brazil. We have also the human resource education and training, interconnectivity ecosystem, and the innovation ecosystem. So we have 7 priorities. But the user as a protagonist is a very important thing because, as I told you, we have 100% coverage of public health in Brazil, but not all of them, all of the citizens has a good quality of healthcare services to attend. So the idea is to make them to be engaged with their health and promote the adoption of health habits and to give them the opportunity to access services by telehealth, for example. And this strategy, the digital health strategy, has as a major structure the RNDS. It's a national network that connects all health actors in Brazil across all over the country, and the idea is to establish a national platform of for innovation, information, and digital health services. So we are connecting all the actors of our healthcare ecosystem with this huge network of data. It's not exactly an information system, but it's a mechanism to connect any kind of information system in all different partners of our ecosystem of healthcare in Brazil. So it's working, and we just started to deliver some services and connections to make possible for the healthcare provider to connect with this network. So just here is just a brief of how that works. All the system and platform has an information model, and it's translated to the computational model and connected to the national network using a standard. And all the provider has access using our gov.br. It's just our application who gives a unified and unique identifier for all providers in Brazil. And we have 3 different applications that is delivered that allows the people to have access to our services. So what we have is that the national network it's a kind of backbone where we have a program, a software that we call Connect SUS. it's just to make the strategy available for everybody. So the healthcare network, both public and private, can be connected, and with this kind of network can allow all of them to make possible the continuity and the transition of care once the patient has the possibility to use different kind of services in Brazil in all states. So I live in Recife, I can be assisted by a doctor in São Paulo or Rio de Janeiro, no matter. And I'm gonna have all my information available through the Connect Swiss system. So it's a very important achievement that we've got in the last few years in Brazil. And what we did for the last 2 years, it's something very, very important, because we have a very huge numbers of the use of that strategy. We have more than 200 systems connected to our network, to our RNDS, and more than almost, I think now almost 500 million of doses of vaccine, of COVID vaccines, that is available on our app, and more than 600 exams lab connected to the network, and millions and millions of COVID results available. So all the citizens in Brazil now can have our vaccine certificate online in different languages, in Portuguese, English, and Spanish. And we are advancing all the network, providing technology to our healthcare facility for primary care. So this map here, it's how connected are our primary care facilities in Brazil. The dark part is where we have more concentrated unity with digital health access. So it's very, very nice. And but we have not all of them with electronic health records working on. So I think now we have about 50% of all healthcare primary care facilities connected to our network in Brazil. But I think it's a very good number. Here you can see the certificate of the vaccine that we are delivering, and we are delivering other kind of vaccine as well. So it's very nice to have that. For the digital health strategy, we have different kind of technologies available, and the government is enforcement. It's providing, how can I say that? It's providing benefits to all the population, but there are some actions that gain a special benefit for the population, that was telehealth. Because during the COVID-19, telehealth was very, very important to give access to everyone in Brazil. And we had to put all that online in about 1 or 2 months. We had already a telehealth program in Brazil since 2007, but before COVID-19, we are not allowed to make consultation with patients directly. So we couldn't do online consultation before 2020. So now telehealth, it's very strange in Brazil, and the government is making investments to provide more and more technology for our public healthcare facilities in Brazil. Our private sector has already a very spread program in telehealth and electronic health record. But telemedicine has really gained all the states in Brazil. So now we have providers in the 26 states and the capital, Brasilia capital. What I'd like to present now, it's exactly the work that our telehealth center is doing now and what we did during COVID-19 pandemic. So our telehealth center is situated on a hospital, on a clinic hospital at the Federal University of Pernambuco. And we have a mission that it's very focused on digital health. And the idea is to disseminate knowledge in the area of ICT in health, seeking excellence and innovation in the productive process of health area. So I coordinate a laboratory. It's a center that is dedicated to teaching and research and to develop actions in digital health. And we work with several other departments and other sectors at our university and the other partners in Brazil. Here is a part of our team, and we have several researchers and professors here, and doctor, nurses, and technical staff that help us to put in place all of our projects. And what NUTS does, we work with research, teaching, and services to society in digital health, and we develop several projects. And I'd like to highlight some of them, okay, in a quick view. In teaching, we have create some environment for online education. We have created two platforms based on Moodle. It's Avamed and Indu. And we deliver courses and disciplines to students of the medical school and also of other department at the university. We develop some components and subjects of health informatics for other postgraduate program in the university. And we had just started in 2020, last year. We are in 2022, 2021, the digital health rotation. It's a kind of internship for medical residence programs and also for the medical students. So they come here and they have experience about how to all the practice related to digital health concerning telehealth, electronic health records, and analytics as well, and other kind of technology that we can discuss and deliver to our patients at the hospital, at the clinic hospital. We have also provide a specialization course in digital health. We're gonna have a new group starting next year, okay? But the majority of strategy concerning teaching, it's related to the medical course at the university, in partnership with the information center, Informatics Center of the university, and some of our partners outside the university that comes here to discuss and to develop a strategy for the market. And what we have concerning research, it's we have several research groups here. I'm just highlighting some of them. And our research line is clinical informatics, public health informatics, and medical images. And we have some students on master and PhD program in neuropsychiatry, computer science, biomedical engineering, and translational health. And as I told you, I work also with all my team here to provide contents and course for the undergrad students. They are very important to the development of digital health in Brazil. So we are integrating some strategy of digital health to the medical course in our university. And Brazil has also a huge strategy to incorporate all the digital technology in the medical course and also in the nursing course and other graduation and post-graduation program in Brazil. We have several partners. I just bring some of them here, and there are sometimes partners that are financing our projects and other that are just giving support to make this happen. And we have here some of the projects that we are doing right now, and all of them it's about digital health, but the majority is related to telehealth approach to deliver care for the population that are on our public health system, SUS. So I'm just giving to you some of the spots about for example, a special interest group that we created here that discuss telehealth and research in telehealth. So we connect several hospitals in Brazil, and we have webinars that happen monthly, sometimes weekly. And these special groups is similar that what you have in United States in the ATA Association and the American Telemedicine Association. So it's a kind of groups that are discussing technology, but at the same time, making the connection in between different hospital and different research group to improve their strategy of collaboration and to develop of multi-center researches in Brazil. For human research, we have online training and update program, and that are delivered through our Indu platform. And here you can see a platform that we provide several teaching program to our clinic hospital. And we have several courses, several webinars and discipline that we discuss with them in the different themes that we have, subjects that we have at our hospital. Here is an example of a webinar that was conducted related to clinical research in telehealth. Another project that we have, it's a digital health training for the community health workers. It's a strategy that combines a self-instruction course and a community challenger for by teleconsulting during 3 months. So we have almost 300 cities that was served by this program, and almost 4,000 agents that are participating on our course. And this is a very, very huge strategy that we'd like to spread all over the country. And we just started that last year. Another program that our biggest program, if I can say like that, is the program that was created in 2000 2003. So it's more than 20 years now. And this is a this is a strategy to deliver telehealth service to the state of Pernambuco. So we develop a strategy to provide telediagnosis, teleconsultation, but also presential consultation. We visit the cities that has no kind of technology, and our teams go there and train all the healthcare profession at the city. At the same time, we make the consultation, and we provide the exams, like for ophthalmology or dermatology. And also we are delivering telediagnosis on radiology. It was very important during the pandemic because we were analyzing a lot of tomographies that were very important to the diagnosis of COVID-19. And with this kind of program, we touch 23 cities in the state of Pernambuco, and we deliver more than I think more than 25,000 telediagnoses was issued. And we are doing at the same time for those patients that has exams that with problems, teleconsultation. So the patient can do the test for example, to diagnose a cancer, dermatological cancer and a skin cancer, and they can have access to a medical doctor at the same time to discuss the case and to give the orientation to make this patient has a good achievement on their case. And what we have also during COVID-19 was the delivery of a website where the patient could have access to our doctor. They can schedule a consultation, and during the 2020-2021, we gave more than 10,000 online consultation, all teleconsultation by video, but we use it chat as well. And we have around 34% of our patient with COVID confirmed. But the mental health issues were very much higher. So we had around 37% of our patient with appointments for mental health. And we had to stop the service because we have no more people, no more doctors to face all the mental health problem that occur during the pandemic. And it's a very huge problem to be addressed concerning the pandemic of COVID-19. At the same time, we open another strategy. We're using the same platform to deliver teleconsultation for all patients of our clinical hospital. So we have two strategies at the same time. One to open for anyone who would like to have a consultation with a physician, and another one with all patients that could come to our hospital because of the isolation, and all hospitals in Brazil, or at least the majority of the hospital, could not have walk-in patients. So we had to put in place services to deliver the teleconsultation for a lot of them, and also to provide some social visits to the patient that were on ICU or on nursing and with nursing inpatients, past patients that could not have access to their family. And it was something that we had to do in about 2 or 3 months. It was really a crazy effort to put all of that in place. But I think it was a very good experience for all of us, and I think it's made our digital health more familiar to the professional. We had to train all the physicians, all the nurses in the hospital to have access to this kind of services, and also to be prepared for the consultation, the online consultation with the patient. The majority of the patients had access using a smartphone, a mobile phone, and it was very important because the population has no computer at home, at least the poor population. So the smartphone was the major device to have access to the doctor. And now we have about 19 specialty giving a teleconsultation, but during the pandemic, the first shot of the pandemic in 2020, we had almost 30 specialty giving consultation to the patient. Here is another example of a strategy. During all the pandemic period, we receive a lot of students here, medical residents, nursing residents that are helping us to deliver the service, and at the same time to learn strategy to make all the services online. So we select some patients to be monitoring, and we have a lot of cases that we could have a good, if I can say, a good report, and a lot of lives that were saved by our telehealth system at our telehealth center. To finish, I have some perspectives to give to you. Our telehealth center has developed during the last 19 years, 20 years, more than 50 projects. We have more than 500 publications, a lot of telehealth services provided, and we think that the next step is to expand the action, the integration, teaching services, research in digital health. I think it's a very good challenge to expand all the delivery of telehealth in our public healthcare system, SUS, to improve access and quality of care, to expand also the digital health practices field, to improve the training and the insertion of our student in a market that is more and more specialized and more technological. So we have to prepare our students to face this new market, and also to continue to disseminate the knowledge and the entrepreneurship in digital health. So we are now starting a new project with partnership with some companies and the industry, and this is a very new age for us, and we have a lot to do in the next few years. I'm presenting to you a book that we wrote with all the EMEA group about the fundamentals of telemedicine and telehealth. Just if you'd like to take a look on that. And it was a collaboration all over the world, and our team has made part of that, and we are very happy to have that opportunity. So I'd like to thank you for the attention, and I'm available for question. And Dr. Ashish, thank you so much for inviting me again, and welcome to Recife.
Thank you so much, Dr. Magdala. This is such a pleasure to meet with you again. And I think the presentation was very insightful. Obviously, I'm very familiar with the work, and I'm also, for those attendees who are here, I would also say that he was able to really leverage this work to do my PhD into this. I think I'll let some of the attendees ask any question. Kelly, Lara, or Sinkwang, if you have any questions for Dr. Magdala. If not, then I have a question follow-up. Like you mentioned about the National Digital Health Strategy. Obviously, post-COVID and during COVID, still we are in the COVID, let's put that way. So what are the 2-3 challenges which you are seeing, both from the implementation standpoint of view and its evaluation standpoint of view?
I think the training, it's a very huge problem that we have in Brazil, because we are talking about thousands and thousands of healthcare workers, and they are planning now to develop a program for digital health, for training the profession that are at the hospitals, but also to change our medical course, for example, our medical course portfolio, if I can say like that. We don't have a lot of strategies to develop, for example, professional to develop system in healthcare. We have to touch both people who would like to use the consumer of healthcare, of digital healthcare, and also to deal with people who wants to develop a strategy for healthcare. So the training program, I think it's the most important thing that we have to do now. On the other hand, we need to improve our infrastructure, our technology infrastructure at our healthcare facilities. When we talk about the private sector in Brazil, it's okay, it's very nice. We have a lot of good hospitals here. But when we talk about the public ones, we have a lot to improve. And I think if you don't have a digital infrastructure at our facility, and professional training professional, and also another issue that is very important in Brazil right now, that is I don't know how to say that in English. It's a kind of digital responsibility, how to deal with that. Because when we use a lot of technology, we are facing different problems, and we have to take care how we deal with the patient using technology. So it's a major problem also. I don't know if I have another.
Yeah. No, I think obviously I am looking at the attendees, because this is getting recorded, so we have to get this recording out to all the audiences here. So I'm just for this help out from that standpoint of view. When you talk about training, and so what kind of opportunities do you see in the training in the area of digital health to the professionals there?
I think we have to establish programs, continuing education programs, and we just prepare a specialization here. It's a kind of here you say certificate program, and just to deal with the profession that are on the market but need to improve their skills on digital health. So we have to provide this kind of certificate program. At the same time, we have to think about the incorporation of the digital health strategy at the graduation and the undergraduation program. But I think it's much more difficult to do it. And we are trying to do that for at least 20 years, and it's not easy at all. But I think certificate programs and short course are very interesting, because all the professional has a limited slack of time to be engaged in training, and we need to think about how to do that on a small caption, small I don't know how to say in English. It's small course, and just to give a quick view of what they can do with technology. And we are working on that here. And I think it could be very nice to develop a strategy with all the experience that you have in the United States.
And just so that, no, we are definitely, I think we have all the essential information now to develop, and also the model of collaboration is there. It has been identified. So I'm sure that early next week, you'll receive a first draft for that. It was just being reviewed. So we are very excited to foster that collaboration. And if anybody else has any questions, Kelly, you have any question for Dr. Magdala? Dr. Magdala, thank you so much for your time. I really appreciate, and I know it is always good to see and meet with you and learn more about the exciting stuff what Brazil is doing. I can tell you for sure, from our standpoint of view, this is just the first start of this. And I'm quite confident that this is going to lead us to opportunities, not just over here, but also in Memphis Health Department, the Shelby County Health Department, which is out over here, which is looking to upgrade their infrastructure, their data modernization, their data infrastructure needs. I think so. There are several avenues of what we can together bring together the best possible practices of the lessons learned across different continents, and see how they can be brought together for the best possible scenarios of how people can uptake and adopt the use of technologies. So with that note, I want to thank you for your time, and I cannot even thank you enough, because this is a very important perspective what you're bringing over here. And I'm sure that a lot of people are going to get advantage of listening, especially in a state of Tennessee where telehealth actually is a very important component. So we look forward to developing more strong collaborations and meaningful partnerships where we can expand on training, research, and infrastructure building. So thank you so much for your time.
Thank you so much, and I hope to welcome you here again in Brazil. And thank you for everybody.
Thank you.
I'm available anytime. Thank you so much.
Thank you. Thank you.